Welcome, everybody. Thanks for joining. This is a short presentation on medication shortages in the UK and wider and worldwide. And this is a view and then some examples and some evidence that I would think is very important for us to consider as we tackle this issue. Some of this, what I'm going to say, is controversial. Some of this is counter the general mass view, but this is really important. And I want to share with my evidence and with my thoughts, what I think is going on and how I think we can reverse this. Firstly, my name is Samuel. I am a pharmacist and I do some coaching now. I'm in the giving stage of my career, so I'm just giving some evidence where we are. It's time to rethink that what we're doing in terms of medicine shortages and medicine management in total. So what I would want you to think as we go through these slides is to really check your cognitive biases, especially your proximity bias and especially your confirmation bias, because you're only going to hear things that you want to hear and you're only going to trust people who are right close to you. And if everyone's thinking the same, then you're not going to have any different, then you're going to die of groupthink. That's what's going to happen. So I've got 5 points here and some data. And this is my research. So I want you to see, based on the hypertension example I'm giving here, that you can have a look at as we've gone through the years. We can see very, very clearly that from the 60s and the 70s, the criteria for diagnosing hypertension, the threshold has gradually dropped. And I've gone on 10-year cycles and I pushed the evidence into the corner here. If you need the paper or this set of slides, I'm happy to share it. Just let me know in the comments and we'll make it available. If you see here, initially the traditional, the good old-fashioned way of checking someone's blood pressure, to a degree when I was working in the global majority countries, was still to go with your age plus 100 and work from there. As we moved into the 90s, you can see this idea started to change. So the number of people being diagnosed with hypertension obviously started to increase. So in the 1960s, there were 4 to 5 million, and this is all UK figures. And then by the time the 1990s came around, there was 13 million. The number had doubled. And what's happened here is that they'd lowered the threshold to 140. At the same time, you can have a look at the notes on the right-hand side. You can see that the numbers or volume of tablets dispensed or expensed, and we've got that data obviously from national records through the Prescription Pricing Authority, the PPA, old money. So we have that there. And then what we have next is this goes up as the threshold for diagnosis goes down. This is the first thing I learned. So lower prescribing thresholds increase the number of hypertensive patients. And this increases the number of drugs bought and sold in the United Kingdom. Now, what you have here is as we reach the point of there are no more patients, we can't pull anyone else in the 1990s, you see another subtle change here in that in the 2000s is there are no more patients now. Patients are hard to find. So what you have, because the threshold for blood pressure checking or threshold for diagnosis is as low as it can be. So the strategy then is to have polypharmacy or combination therapy. And it grows and grows and grows and grows. So as you see, the patients don't grow between 2000 and 2020. The volume of drugs used almost double. And this is where the concern is. And to illustrate this a little bit, I just put it into a graph for you. So as your drugs are going up, the red line, over the course of the last 40 or 50, 60 years, you see the number of patients rising. And that's interesting to a degree. But when you then look at it much more graphically, based on the change in diagnostic thresholds, that's when you see the growth in drugs. And if you go back here, as I said to you, in 2000, it all slows down. The number of patients doesn't grow that much, but the volume of drugs grows still at an alarming rate. So what I'm saying here is we need to rethink how we do blood pressure as just one of the many reasons that medication is overprescribed in our modern world, and we can't keep up the manufacturing. Thank you for listening. If you want any further slides or you want any further conversations about it, leave a comment and we'll get back to you.